Recovering from an illness or an injury isn't always easy. Occupational therapy can help patients get back to their normal daily activities. So joining me now is Aamodt, with an occupational therapist with Mercy Medical Center. Thanks for being here.
Yeah, thanks for having me.
So what is occupational therapy and how does it differ from physical therapy?
Good question. We get that a lot in the hospital. People know what PT is, they don't know what occupational therapy is. So kind of the way I describe it to my patients is that PT's job is to make sure you can get from A to B safely. And then OT's job is to make sure you can do everything at A and B safely. So very basically, on the hospital, we want to make sure people can use the bathroom on their own, get dressed on their own, shower on their own after the medical injury that they're in for. And kind of that's the basic, and then all the way up to, are they safe to go back to work, drive, care for their children, pets, all that stuff is kind of those daily occupations we want to get them back to.
Yeah, so many tasks you take for granted and don't realize, you know. So what does a typical occupational therapy patient look like?
Good question. It's pretty much anybody who comes through the hospital. So in the acute care setting, it can be somebody who's had a bad car accident, a stroke, a heart attack, bad broken bones, people who come in for elective joint replacements. Our job is to kind of look at the illness, see how that's impacted their occupations, and then kind of help them get back to normal.
Yeah, it has to be so rewarding to watch them as they continue to get better. Why did you choose this career path?
I always knew I wanted to help people. It's super diverse and really rewarding. Again, to get somebody who comes in after having had a stroke, you know, they maybe can't use one side of their body, and for us to help rehabilitate, get that arm moving, get them back to playing with their kids, golfing, driving, back to work, all that's super rewarding.
Yeah, that's awesome. How can people utilize occupational therapy for in or outpatient?
Good question. So yeah, if you're in the acute care setting, hospital orders will come through. We'll just automatically see you and make sure you're safe to go home. OTs it's a really wide and diverse setting too. So we actually have OTs in the schools where they're helping kids with developmental delays keep up and participate and play in school, because that's a kid's occupation. We have hand therapists, so if somebody has arthritis or tennis elbow or anything affecting their hand, we have outpatient therapists that can help them get back to normal.
Yeah, that's awesome. Is there anything else you'd like people to know about this?
For occupational therapy, again, people think of us just as like hips and knees and joint surgeries and stuff like that, but it's really so much more. Again, if it's playing with your grandkids and it's hard, or doing those meaningful hobbies that are meaningful to you, reach out to your doctor, and if you need help with those, ask for an OT order and we'd be happy to help you with those things.
Yeah, great advice. Thank you. Aamodt with Mercy Medical Center. Thanks for being here.
Thank you much.
Stay with TV9.